My name is Caitlin Walsh, and for assignment 1, I've chose the article titled Barriers to Implementing the Sepsis 6 Guidelines in an Acute Hospital Setting. The purpose of this study, research has shown that there are many barriers related to the implementation of sepsis screening and prevention. The main thing that they talk about in this study is the Sepsis 6 Guidelines, which includes 3 diagnostic and 3 therapeutic interventions for sepsis. The 3 diagnostics could include anything from a serum lactate, cultures, and vitals, and 3 therapeutic interventions, antibiotics, fluids, and oxygens. The study explores the many possibilities by conducting a research study in real-life settings. From experience, I work in an emergency room, and we do have a sepsis screening during triage. Any vitals that are outside of normal parameters that would fall into the sepsis category, such as low blood pressure, high heart rate, extremely low or high temperatures, it would automatically flag our system for sepsis. The physician is immediately notified, and if felt necessary, interventions are immediately initiated. So the research question for this study includes: what are the barriers to sepsis screening and prevention? Why is compliance with the Sepsis 6 difficult for healthcare professionals? The description of the study setting and sample: there were 108 people that included doctors and nurses from 1 emergency room, 2 different medical wards, and 2 surgical wards in the same hospital. The main setting and sample of this study is an acute care setting. So emergency room, of course, is top on the list, and then they pulled from different areas of that hospital. The design of this research, it was conducted through a paper survey questionnaire. They originally sent out 240 paper questionnaires. However, there were only 125 sent in, and only 108 were actually used for the results due to lack of completion of the survey. The survey consisted of 25 questions, and they were divided into 4 main categories. So the demographics, identification factors of sepsis, resources for sepsis, and educational programs. The results from the 108 respondents showed that both the doctors and nurses agreed that the main concerns were lack of knowledge and nursing delays, so nursing shortages, whatever the case. Early recognition of sepsis, such as temperature parameters and lab results, were often missed due to knowledge deficits. Some people do not have a background on sepsis. They don't know vital parameters. So lack of knowledge is a huge issue there. And I can see where nursing delays could be an issue as well. You get in a hurry, you're unable to notify the physician of the vital signs, things get kind of pushed back. That's very common. I've seen it done a lot, especially in the emergency room. It's easy to overlook those certain early signs and symptoms because you have so many other things on your mind, but it's very important that sepsis is caught at an early stage because it can be very deadly and very dangerous to the patient. So implication for nursing practice, there's several things that can be done. One of the main things is education. It's not necessary neglect or that the nurses don't care that the patient is possibly septic. It's that they don't know. They don't know those lab values. They don't know those vital sign parameters. They don't know even the definition of sepsis. So this study suggests that educational programs be implemented at the beginning of employment. So new hire welcoming educational programs, they suggest it be started there, and then frequent refresher courses for current employees. These programs, they need to be revised to represent each acute care setting. So the emergency room is going to be looking for different signs and symptoms than the medical ward or the surgical ward. The emergency room, the patient's just coming in, walking through those doors. It's a little bit different, and you can pick out if they're immediately septic versus the medical floor where they're slowly becoming septic. The nurses have to look for different signs and symptoms. Although basically the same, there are different things for each area, and it needs to be specifically designed for that area. Once again, some important identification factors such as vitals and lab values should be common knowledge, but they're not. Whether that needs to be posted, whether there's a flag in the computer system when certain vital signs and lab values are entered so that it can be caught and immediately notify the physician. Just different things that nurses can do to better their knowledge and hopefully prevent septic patients from becoming increasingly sick and septic and possibly die. Some of the resources, this article was written by Sarah Jane Breen and Sharon Reese. It can be found right here at this URL. And once again, the article title is Barriers to Implementing the Sepsis 6 Guidelines in an Acute Hospital Setting.